Hello everyone, my name is Robert Johnson, student at Nightingale College. The reason why I'm here, I'm going to be performing a video for the administration of oral medication. Today, I am wearing my uniform. I do have my ID on. ID including the shoes. My equipment is all here. I do have hand sanitizer here for keeping my hands clean. I do have tissue here for wiping the bottles for the oral medication. For the liquid medication. For this skill, I will be using MAR sheet number 3. This one included medications such as the amoxicillin, which is 250 milligram, metformin, which is 500 milligram, and also phenytoin, which is 100 milligram, and ferrous sulfate, which is 65 milligram. Also, I have liquid medication of 500 milligrams, 15 ml. This is Tylenol, acetaminophen. Right? So, first things first, I need to compare the electronic health records to the electronic health records to the doctor's orders. Compare those, and what I'm checking for the 6 rights. It's going to be the right patient, right medication, the right dose, the right route, the right time, and the right documentation. Right? Those things look good. Comparing the physician's order to the electronic health record, that looks good. Now from there, I'm going to go ahead and compare the electronic health record to the MAR, right? Once again, checking the 6 rights. Those all look good. And now that I went ahead and checked those things, they all look good. I'm going to go ahead and get my hands clean because I am going to be handling the medication soon. All right, so I'll go to the medication drawer. I'll get those meds out. And I'm going to pull the meds from the drawer and compare the medications against the MAR. And once again, I'm checking the 6 rights. So for all the pills that I have here, I'm checking against the MAR. That one looks good. Go to the next one, check it against the MAR. That looks good. And so on. I'm going to do that for all 5 medication, 4 tablets, and 1 liquid medication. Check it against the MAR. Do the 6 rights. That looks good. And checking it against the MAR. That looks good. Right? Same thing with the medication, or the oral liquid medication. I'm going to check that against the MAR as well. That looks good. So since everything looks good, I'm going to go ahead and head to the patient's room and introduce myself. Knock on the door. Hello, Mr. Jones. My name is Robert, student from Nightingale College. I'm here to administer your oral medication. Your doctor has an order for you to have medication at this time. Right? So first things first, Mr. Jones, let me go ahead and pull your privacy curtain. And then I'll go ahead and wash my hands. Right? Wash my hands. Wash my hands. All that's good. Okay. All right, so it's always important to make sure you wash your hands. It's always important to make sure that you introduce yourself to the patient, inform the patient why you are there. Don't assume that the patient knows why you're there. Inform the patient why you are there. Now that I wash my hands are clean. Now I am okay to touch the patient or make physical contact with the patient. Mr. Jones, may I please see your ID band so I can compare your to finish identifying you? And can you please tell me your name, your full name, and your birthday? Okay, name is Walter Jones. Birthday is 1965. March 5th, 1965. Thank you, Mr. Jones. Okay, so, Mr. Jones, as I said, I'm going to be administering your oral medication. But before we begin, I'm going to ask Mr. Jones if he has any allergies. Mr. Jones stated he has no allergies. Do you have any allergies to any seasonal allergies, any allergies to medication, or any allergies to any kind of foods? Once again, Mr. Jones confirmed that there's no allergies at all, which is good. So from there, I'm going to go ahead and clean my hands real quick one more time. Right, and Mr. Jones stated there's no allergies at all, so I'll go ahead and clean my hands. Okay. Make it easier for me to put my gloves on because I will be handling the medication. Right. Alrighty. Alright, I'll take that there. Let's put these on. Try not to rip these gloves. Okay. So, let's see here. One of the pills you're going to be getting, Mr. Jones, it's going to be amoxicillin. I would explain to Mr. Jones that the amoxicillin is 255 milligrams. It is used for treating infections such as respiratory, sinusitis, Counterindications, I would also explain that to Mr. Jones. That is that hypersensitivity, meaning that if a person has hypersensitivity before in the past, we won't give that medication to that patient. Another thing is, let's see here, if a person is, if he's hypersensitive to penicillin or any other type of antibiotics, I have to be careful and contact the doctor on that. If he has severe renal impairment, I would make sure that also notify the doctor that is a contraindications. Adverse reactions and side effects, I will let Mr. Jones know that it could be diarrhea, it could be a rash. The serious adverse reaction or allergic reaction could be, if it's a high dose, it could actually cause you to have a seizure, Mr. Jones. So we want to also make sure that you communicate if there's any type of issues that you may have with any of these, whether it's going to be diarrhea or the rash or anything like that. Any questions about the amoxicillin that you're going to be taking? No? Okay. Then I'll go on to explain about the glucophage, which you're going to be taking, which is metformin, glucophage. That is going to be for it's 500 milligrams, and it's going to be used for your treating the type 2 diabetes. I will also explain to Mr. Jones the side effects and counterindications of that. It is, let's see here, hypersensitivity to metabolic acidosis, I do believe. And also, I will let Mr. Jones know about the adverse reactions, which is lactic acidosis, also abdominal bloating, diarrhea, nausea, vomiting. That's also a side effect, and adverse reactions you can have from that. You have any questions about the medication? No? Okay. And the other one is phenytoin, which is Dilantin. It's going to be 100 milligrams of that. I would explain to Mr. Jones that this is used for the treatment of seizures, but also it is used for antiarrhythmic for the heart. I will let him know that I will find out if the patient has been drinking alcohol at all, because that's a counterindication. Patients should not be having any alcohol in the system when he's taking that medication. Adverse reactions of this one could be cardiac arrest. It could be tachycardia, hypotension, nausea, and constipation for the phenytoin. Please let us know if you have any of those issues. Do you have any questions for the phenytoin? No? Okay. So then the next one is ferrous sulfate, which is 65 milligrams of ferrous sulfate. It is used, usually the doctor will prescribe that for a iron deficiency, right? Iron deficiency anemia, right? And a counterindication of this one is if the anemia is not related to iron deficiency. So that is one of the counterindications, that if the anemia is not related to iron deficiency, we will not be given that. Also tell Mr. Jones about the side effects and the adverse reactions. Dark color stool, so that the patient doesn't panic that he sees black or a dark color stool. We want to make sure that the patient understands that it could cause dizziness as well. Constipation, make sure he understands that, and ask me if you have any questions. Mr. Jones, do you have any questions about those side effects? Any questions about the medication? No? Okay. So the last one is going to be a liquid medication. It's going to be 500 milligrams, 15 mLs of the acetaminophen, Tylenol, trade name. So one of the counterindications that if a person had previous hypersensitivity to the Tylenol, we would not be given that one at all. Also, we want to also check if the patient has been drinking any alcohol or any aspartame. That is a counterindication. We don't want to give it if the patient has been having alcohol in the system. Side effect is hypokalemia. We want to make sure that patient is aware of that. And also a side effect can be increased liver enzymes. If the patient is having any of those things, including constipation, we want to make sure that we tell Mr. Jones this is not, if he has any of those things, please let us know. Any of the, he won't know if you have increased liver enzymes. So, of course, he won't know that. But we will be looking out for that if there's any type of increased liver enzymes, right? So, from there, Mr. Jones, for your medication, I'm going to raise you up in the bed, make sure that you're at the right level. I did not put the pills in a cup yet because I always like to make sure that if the patient has any problems, any questions, then it's easier to waste that pill. I could always put it up to the side and waste it while it's still in the package, right? Instead of having the pill out or loose, right? So, Mr. Jones stated that he does want water. Would you like water with your meds? Okay, just confirm. Patient will have water. None of these pills will be crushed. There's no need to do any additional dosage calculations. All of the orders are consistent with the actual medication that's as packaged. So I'm going to go ahead and before I put the med in a cup, one last time, I'm going to check the medication up against the MAR, right? That one looks good. Doing the 6 rights, just checking it one last time. And checking that one up against the MAR, 6 rights, that looks good. And this medication, check it against the MAR, one last time, 6 rights. And that looks good. And this medication, I'm going to check it up against the MAR, 6 rights. Okay, and I will go ahead and give the patient medication, right? Patient's in the right position. Take the pills, and here's your water, Mr. Jones. All right, patients drink the water. Good. Would you like some more water? No? Okay, good. So the next medication I'm going to prep for you, sir, is going to be the liquid medication. I'm going to make sure I shake it up, right? And it's very important that, this is where the tissue is going to come into play. Very important that I want to protect the label. So what I want to do is I want to palm the label, right? And when I pour, I'm going to pour always away from the label, because if you think about it 24 hours a day, how many times they give this medication, the integrity of the label can be damaged. So I want to do this. I want to take the top off, make sure I place the top up, and I'm going to get at eye level, so I can pour 15 mLs. Let me find my 15 mLs in here. Good. 15 mLs at eye level. And make sure the cup is not touching the inside. 15 mLs. Okay. Right, 15 mLs. I want to get a tissue. I want to wipe around the bottle. Right, put this in the trash. There. Lid, put that back on. Right, and I don't know if you're able to see it, but I'm going to go ahead and take a moment and show the camera the 15 mLs. Hard to see it, I know, because my hand is not flat, but yeah, it's 15 mLs. I'm going to go ahead and let Mr. Jones drink that. Okay, Mr. Jones, here you go. Mr. Jones, drink the 15 mLs. Okay, now from there, I will go ahead and clean up this area. Any trash left behind. I'll make sure Mr. Jones is comfortable. Let's have you sit up for a while because you just took your medication. We don't want you to lay down flat just yet. Here's your call light. I'll come back in another 20 to 30 minutes to check on you. Do you have any questions at all, Mr. Jones? No? Okay. From there, I'll take off my gloves, perform hand hygiene, right? As I said, the bed is at the lowest position. As I said, patient does have the call light. And I will go ahead and document the medication that I just given and any possible side effects that may occur within the next hour. Okay? All right. Thank you very much.